So oftentimes when we're teaching the SFMA, clinicians ask me, how do I explain to my patients why this is important for them, or how does it benefit my patients to be utilizing the SFMA in my evaluation process? And I think that's actually a really simple answer, and it's something that as therapists we think about all the time, but we don't always do a great job of explaining to our patients. So think about it. Your patients come to you in a state of what we call subconscious dysfunction. They hurt somewhere or they can't do something they want to do and they can't figure out why, so they're coming to you for help. We can quickly, utilizing the SFMA, bring them into a state of conscious dysfunction. So they're still hurting, they still can't do these things, but now we can explain to them exactly why they can't do it or why they're hurting as it relates to their body and all of these different things that interrelate with our mobility stability model. From there, obviously, as therapists, our intention is to quickly move them into a state of conscious function. So they're being very aware of how they do things, the way that they sit at work, the exercises that they have to perform at home, but now they're feeling better. They don't have pain, they're starting to work back into their activities, and ultimately we want to take them to that state of subconscious function. So they can go out, play whatever sport they want to play, do whatever activity they want to do, and they don't have to think about it. And by utilizing the SFMA and finding that root cause that Mike talked about, we can get them to that point where hopefully we don't ever have to see them again with no other injuries, or at least not that same injury. So the great thing about utilizing this functional continuum model and explaining that to your patients is it empowers them to take control of their rehab. It makes them understand the importance of their home exercise program versus just handing them a sheet of paper and asking them to do something that doesn't seem to be relevant to them. So this is a great way for patient education to be a reinforcement. Remember, we talk about reset, reinforce, and reload. This is a great reinforcement utilizing the functional continuum.